Well, let's begin with the first two megatrends: the diffusion of VIP care for the chronically and mentally ill, and the emergence of digital medicine leading to the closure of hospitals. These are interlinked, and they really begin with the fact that more individual consumers are going to make choice about their health insurance. A large part of that is going to be driven by the exchanges, where individuals go onto a marketplace and choose their health insurance coverage. The Congressional Budget Office has predicted that they think about 25 million people will be shopping on the exchanges, sort of plateauing out in 2017. My own view is this is probably a low estimate. If exchanges really work well, we'll have a lot of people either in the public exchanges, healthcare.gov, or visiting private exchanges with their employers and choosing. What do exchanges do? They empower individuals using their own money or subsidized premiums to decide what health insurance they want. And they make a choice largely on price. How do we know that? Well, if we look at this year's exchanges, it turns out that 85% of people who shopped on the exchange shopped for silver or bronze plans. Remember when we explained the Affordable Care Act? In the exchanges, all health plans are offered at 4 metal tiers: bronze, silver, gold, and platinum. And as you go up, they become richer. More doctors and hospitals included in the network, more benefits in terms of drugs covered, and lower deductibles and co-pays. The consequence is the premium goes up. Most Americans are going to shop for a lower premium plan. That's what we've seen in the first few years. When they shop with their own money, they shop for lower premium plans. What is the consequence going to be? Well, for health insurers who think that the exchange is going to be really important, they have to focus on getting high quality plans at a reasonably affordable premium for the silver and bronze plan. That's where the vast majority of Americans are shopping. Now, insurers understand that when they look at their profitability, in the past, that's the solid blue line in this graph, they made most of their money on low-risk people. That's young, healthy people who often didn't use any health care or used a very small amount of health care. And they tended to lose money on higher-risk, chronically ill patients who use a lot of resources. The future is going to look different for them, and that's the dotted line, where they're probably going to break even for the low-risk, young, healthy people coming in, but make money on people who have chronic illness by being able to service them better. Remember, in the exchange, one of the key elements is risk adjustment. So insurance companies that enroll a lot of young, healthy people are actually going to shift money to insurance companies that enroll sicker patients. That's one of the reasons that insurance companies will begin making more money on sicker patients. Another reason is use a lot of healthcare resources. They'll be able to deliver the care more efficiently and make money. That has a direct implication for hospitals and doctors. They will need to be able to offer healthcare services much more cheaply to get into the networks that are offered in the silver and bronze plan. No matter what hospital you are, you cannot afford to be excluded from the silver and bronze tier. It's going to be very hard to make it just with your private insurance patients and your Medicare patients. You're going to have to be included in the exchange at the silver and bronze level. How do I know that? Maybe you've heard of Cedars Sinai Hospital. It's in Los Angeles, and it's the hospital to the stars, where every Hollywood name goes when they need medical care. This year, it was excluded entirely from any health insurance plan offered on the California exchange. And they were very upset at Cedars Sinai. They loudly protested that they were excluded even from the premium plans, and they've talked to state legislators trying to ensure that they are no longer excluded from the plan. If the hospital for the stars thinks it has to be on the exchange and has to be offered, then just imagine what every other hospital has to do. They cannot be excluded. Well, if insurance companies have to offer an affordable plan, they're going to have to get hospitals and doctors to deliver care in a cheaper way. The bank robber Willie Sutton, when asked why he robbed banks, said, That's where the money is. Well, where is the money in healthcare, and how can we save money? How can hospitals and doctors actually deliver high-quality care at a lower cost? Well, remember this equation. P times V equals total cost. That's price times the volume of services is the total healthcare cost. So to save money, you have to both reduce the price and reduce the volume of services. Well, how can that be done? Remember this graph. This is, as I said, one of the most important graphs in health policy. And let me draw your attention to the itty-bitty bar there. That itty-bitty bar says that half the American population is basically out of the healthcare system, using almost no healthcare services. Just 2.7% of all costs go to 50% of the population. And who are those people? Young kids, young adults who are essentially not using healthcare services. They might get an ear infection or strep throat and need antibiotics. They might cut their finger needing a few stitches. They might break their arm playing soccer needing it set, but they don't use a lot of healthcare services. On the other hand, you see that third bar? That says that 10% of the population uses nearly 2/3 of all healthcare costs. So if you need to improve quality and reduce your costs, you need to focus on that 10%. And who are they? Well, they're people with chronic illness, coronary artery disease, congestive heart failure, emphysema, asthma, hypertension, diabetes, cancer. It's people with chronic illness that lead to high spending. As a matter of fact, some recent studies have shown that 85% or so of all healthcare spending goes for chronic care. Only 15% or so goes for acute problems like broken bones or stitches. So it's people with chronic illness where we spend all our money. And you might remember this slide. Of the $2.97 trillion the United States spent in 2013 on healthcare, about 1/3 of it went to hospitals, nearly $1 trillion, and a little over 20% went to doctors. So if you're going to reduce costs, you really have to focus on hospitals and doctors. So how is the healthcare system going to lower the total cost of care? There are really two approaches, focusing on reducing prices and focusing on reducing volume. Next, we're going to look at 4 different strategies to address price and volume.